So
All
good day,
fine. Yeah.
everyone. Thanks, Gary. Good day, everyone. I bring warm greetings from the Social Innovation in Health Initiative, or we pronounce it as SIHI, Global Network, and of course from the Philippines, where I am at right now. We're about to end a very long day. It's early evening, and it's a pleasure to be here to share stories and experiences of the SIHI Global Network journey. My name is Meredith Labarda. I'm a professor and a medical doctor at the University of the Philippines, Manila, where SIHI Hub and the SIHI Global Secretariat is lodged. So the title of my presentation is Advancing Community Engaged Social Innovations Through Research. So just to walk you through the outline of my presentation, I'll give a brief context and I'll jump into social innovation to transform healthcare delivery and how SIHI would embed social innovation research in different countries to accelerate universal health coverage. I'll talk a little bit about the network and our expansion. And of course, from social innovation research, how is it linked to UHC and SDGs? And I'll end with our journey towards institutionalization and sustainability. Let me start my presentation by saying that in the last century, the world has witnessed many great medical advances. However, the reality in the health systems and services offered to millions of people across low and middle income countries remains far from the actual needs and expectation. In other words, healthcare delivery gaps still exist. And this is affirmed by the World Health Organization and World Bank study that says half of the world lacks access to essential health services. In Social Innovation in Health Initiative, or SIHI Global Network, we see this challenge as an opportunity to front-load community-engaged social innovations to bridge this healthcare delivery gap and transform health systems towards the achievement of sustainable development goals and the attainment of universal health coverage. So what are social innovations in health? We define social innovations in health as inclusive solutions that meet the needs of end users through a multi-stakeholder, community-engaged process. Furthermore, social innovation in health offers a new lens to strengthen and transform health systems and primary health care. They address complex and systemic health challenges through participatory approaches, and these novel solutions are designed and implemented by innovators, health system actors, communities, and a wide range of stakeholders whose aim is to address the healthcare delivery gap, especially among the vulnerable population. Social innovations can either be products, they can be processes or market mechanisms, even roles or behavioral practices, new paradigms, and even policies, or a combination of all this. They enable healthcare delivery to be more inclusive, effective, and affordable. So how do social innovations look like in real-life settings? In the next few slides, I will be sharing some examples of social innovations in health from the different SIHI country hubs. What particular challenge did the social innovation address? How the social innovation addressed the health challenge, and what were some of its impact? Let me start with the Inter-Island Health Service Boat Project. This is a social innovation from Zumaraga in the Philippines. Zumaraga is an island municipality composed of 25 coastal villages, and it is one of more than 700 geographically isolated and disadvantaged areas, or what we call GIDA, in the country. Access to the municipality is only through a 1-hour passenger or private boat ride, and transporting high-risk pregnant women in an accredited birthing facility is challenging due to the lack of circumferential roads. And prior to the implementation of this project, facility-based deliveries and skilled birth attendants were only about 20%. That's versus the national target, which is 95%. As an innovative solution, the Inter-Island Health Service Boat Project is a sea ambulance, or a boat referral system that connects remote barangays or villages, village health stations to the main birthing facility in the poblacion, or in the center. It also ensures that a designated boat driver and fuel are always available and accessible for timely referral. The birthing facility is also accredited by the Philippine Health Insurance Corporation, or PhilHealth, that's the country's national insurance, to provide basic maternal and newborn packages. Hence, it is entitled to claim reimbursements for every PhilHealth member who delivers at the birthing facility. So this reimbursement fund funds the operations and maintenance of these boats, a mechanism that sustained the project through the years. 2 years after its initial implementation, Zumaraga improved in its facility-based deliveries from 20% in 2013 to 90% in 2015. In addition, the facility earned more than 1 million pesos, that's approximately $20,000 from PhilHealth reimbursements. And this has allowed the health center to strengthen implementation of not only of birthing, birth of the pregnant women, but also key priority health programs. So in November 2016, the Rural Health Unit of Zumaraga was awarded by the Department of Health as one of the regional achiever for its exemplary accomplishments and performance in implementing maternal, newborn, child health, and nutrition programs in that year. This recognition attests to the significant impact the project has brought to address specific problem in the community. A second social innovation is the Chipatala Foni, or CCPF, or Health Center by Phon in Malawi. Malawi is has one of the highest rates of maternal, child, and infant mortality in Africa and of the world. A woman living in Malawi has 1 in 34 chance of dying during childbirth. That's according to World Bank study in 2014. And child mortality rates are significantly high at 71 per 1,000 live births. In addition, UNDP reports that Malawi's maternal mortality rate is 675 deaths per 100,000 live births, one of the highest in the world. And especially in remote rural areas, pregnant women and mothers face the challenge of lack of access to quality maternal and child health care due to the distance from health facilities and having insufficient trained health workers serving the population. And just like other communities, there are also myths and misinformation that affect where and when they would seek health care. So this social innovation, CCPF, provides a toll-free hotline where callers can speak with trained health workers to provide information on a wide range of health issues, triage calls to doctors, and refer callers displaying danger signs for further care at a village clinic, health center, or hospital. It also provides a mobile message service for personal text or voice messages on maternal and child health topics customized to a woman's month of pregnancy or a child's age. This is a multi-sectoral partnership enabling the national scale-up and transition of the first government-led toll-free nurse-led health hotline. One of the changes noted among the CCPF users was their increased knowledge of available maternal health services, including the awareness of the number of recommended prenatal visits and what to bring to the health center for labor and delivery. CCPF has also reduced the burden on the rural health facilities and rural health workers by resolving 75% of the calls without referral to a health facility. And over 94% of users expressed satisfaction with the service because of its accessibility from their homes, with rural residents able to save time and travel costs. Another social innovation from Peru is what we call Mamás del Rio, or Mothers of the River in Peru. Maternal and neonatal deaths are a serious health problem in Latin America and the Caribbean, despite the fact that many of their causes are preventable. In a 2010 to 2012 health survey, Loreto was the department with the second highest maternal and infant mortality rate in the country, averaging 18.7 per 1,000 live births. And another study reports a neonatal mortality rate of 31 per 1,000 live births, with infection being the most frequent cause. And among the main barriers are difficult access to health, lack of culturally appropriate delivery care by health facilities, and unfavorable attitudes in seeking medical assistance. In addition, a census also conducted in 3 districts of Loreto suggests inadequate hygiene conditions and gap in newborn care coverage, both at home and in health facilities. And during the COVID-19 pandemic, these challenges were even exacerbated. A social innovation called Mamás del Rio, or Mothers of the River. This is an initiative developed and implemented by a multidisciplinary team whose main objective is to improve the health of mothers and newborns in the Loreto region of Peru. To this end, they provide training to midwives and community health agents to know how to detect emergency signs of pregnancy, childbirth, postpartum, and newborn, and prepare for home delivery in case institutional delivery is not feasible. Home education visits are made, like 3 prenatal and 3 postnatal visits, using tablets with a ComCare application that allows data to be uploaded from each visit. And what's good about this social innovation is during the COVID-19 pandemic, the program rapidly adapted to meet the needs of the local people, including delivery of materials and equipment for basic COVID-19 prevention, managing misconceptions through phone supervisions, developing video training for community health workers about COVID-19, and continuing home visits for people with COVID-19 symptoms. So since the start of the pandemic until about December 2020, community health workers have conducted 1,113 visits to pregnant women and were able to provide 270 safe delivery kits and counting. And the project enabled the community to sustain maternal and neonatal health services while responding to the urgent needs of the COVID-19 pandemic. These responses affirm the importance of local community mobilization and the flexibility of projects that may already be operating in the field to improve other health outcomes. But many social innovations in our communities remain underfunded, unheard of, and not scaled up because of the lack of evidence to prove that they actually work and that they bridge the gap in healthcare delivery. Thus, in SIHI, we ask the question, what if community-engaged social innovation research played a catalytic role in accelerating universal healthcare coverage? And what if they can also be part in achieving the Sustainable Development Goals? Quality research that is reliable, ethical, and answers the key question is necessary to make policy decisions. For this to occur, research cannot be conducted on community members as subjects. Rather, research must be undertaken with community members as co-investigators. In 2014, a collaborative undertaking emerged between the Special Program for Research and Training in Tropical Diseases, or TDR, the University of Cape Town, the University of Oxford, and the London School of Hygiene and Tropical Medicine. The Social Innovation in Health Initiative, or SIHI, was developed on the premise that solutions to many health problems can emerge from communities even in low-resource settings. The initiative is dedicated to advancing the understanding and the application of social innovation in the Global South to address inequities in health. So it has expanded in 2016 to include social innovation research hubs in China, Colombia, Malawi, Uganda, and the Philippines. And these country hubs provide a platform to convene the various health actors to promote and catalyze social innovations in health through research, capacity building, and advocacy. In 2020 to the present time, the network continues to expand and thrive. And now with 13 SIHI hubs and other partners, the SIHI Global Network is invested in advancing social innovation in health through research, capacity building, and advocacy. As mentioned earlier, 13 SIHI hubs are present now in 4 regions. We have 6 SIHI hubs from Africa, that's 1 in Malawi, Uganda, Ghana, Nigeria, South Africa, and Rwanda. 4 hubs in Asia, that's in the Philippines, China, Indonesia, and India. 2 hubs in Latin America and Caribbean, that's in Honduras and Colombia. And recently, we have launched our newest SIHI hub in Sweden. And through the network, we endeavor to embed social innovation research in other countries as well. As the network continued to expand, coordinating activities and developing effective communications through this expansion has become an increasing challenge. Thus, the work of the SIHI Secretariat, hosted at the University of the Philippines, commenced formally in May 2020 and continues up to the present time. As Secretariat, our main functions in the network are partner coordination, SIHI Global Network communication, and of course, the sustainability of the network. So what do we do in SIHI? With the help from independent experts panel, we identify and showcase social innovations in healthcare delivery challenges. We also bring together diverse actors to collaborate towards advancing social innovation in health. And more importantly, we contribute to the growing body of research on social innovation in health through publications and visual media. In addition, the network contributed to many journal articles related to social innovations in health. For instance, in 2020, the network contributed a series of articles published in the Journal of Infectious Diseases of Poverty with the theme Social Innovation to Transform Healthcare Delivery. And more recently, the network also contributed to a number of research publications to the BMJ Innovation Special Supplement on Social Innovations for Health, which focused on social innovations and highlighted case examples that have had a significant impact on health outcomes. And this was launched last May 17, 2022. The network, through the SIHI Secretariat, also facilitated multi-hub research projects. In 2020, the SIHI has been selected as a partner by WHO's Health Emergencies Program to develop a community engagement package that will support the implementation of various health interventions. More recently, the several SIHI hubs are also engaged in an ongoing research project called Evidence and Research Capacity Strengthening in SIHI with Intersectional Gender Lens, a contribution to implement TDR's intersectional gender research strategy. There are also several research tools that have been co-created and vetted among the different SIHI hubs. Example of this is the Practical Guide on Crowdsourcing in Health and the Health Research. The purpose of this guide is to provide practical advice on designing, implementing, and evaluating crowdsourcing activities for health. Another is the Social Innovation in Health Monitoring and Evaluation Framework. And the purpose of this document is to provide a framework for social innovations that will help democratize research and engage more stakeholders to work in partnership with fellow researchers. The global network, through its SIHI hubs as the implementing arm, together with many contributing partners, continue to advance social innovations in health through advocacy, capacity building, and research. Through research, we would like to demonstrate the impact, the scaling up, the replicability, and the sustainability of these social innovations in health, and eventually be able to integrate them into the health system. Democratizing the research process would mean the inclusion of the social innovators and the implementers in the communities, not as subjects, but as co-investigators who participate in the social innovation process. Including them in the health research process mean that we can provide results that match their actual needs, that would integrate people-centered services into the health systems. To achieve the Sustainable Development Goals and to attain the universal health coverage, we need transformative change. And we don't want to be stuck in a one-size-fits-all approach because we know that each community is unique. And this is where the community-engaged social innovations become very relevant now more than ever. Beyond the health impact, we want to reach the vulnerable population, reach the last mile. And when we bring the community social innovators into the picture, we democratize research. We foster intersectoral partnerships. We empower the community, and we transform the system and enhance resilience. So moving on, the SIHI Global Network continues its journey towards institutionalization and sustainability as we aim to integrate and institutionalize these social innovations in the health systems and other established systems in the country. An example endeavor is SIHI Philippines partnership with the Philippine Council for Health Research and Development and the Department of Health, which commenced in 2020 when we launched the Helia Castillo Award for Research on Social Innovations in Health, or what we call GCARSI, named after one of the country's national social scientists. This nationwide open call aims to recognize the outstanding social innovations that are developed by Filipinos for Filipinos that address persistent societal and health systems challenges. What's good about this endeavor is part of the incentive for the award is a cash prize which can be used as a seed money to scale up this social innovation, together with a research and development grant and a training and mentoring package, all provided for by the PCHRD and the Department of Health. Furthermore, some SIHI hubs have now transitioned from being a hub to become a center in their university. A good example of this is the SIHI hub in Malawi, hosted in Kamazu University of Health Sciences, that is pioneering a center for innovation and research to provide more support to Malawian innovators in their journey. In closing, we ask the question, what if people were supported and empowered to address their own health problems with locally generated solutions? What if research could enhance community engaged social innovation and accelerate universal health coverage and SDGs? These are the ongoing inquiry of the SIHI network to better understand the value and contribution that social innovations can make to strengthen and transform health systems for greater inclusiveness, equity, and affordability of healthcare services for all. And this is my last slide. And on behalf of the SIHI Global Network, we would like to acknowledge that our work is made possible with the support of the Special Program for Research and Training in Tropical Diseases, or TDR, together with a variety of many partners, including SIDA, who has contributed designated funding for this project. Thank you very much for your kind attention, and I will be happy to answer questions about SIHI if there are any.